How to properly wear your personal protective equipment. Hi, this is Dr. Amy Munoz, and we're going to be talking about personal protective equipment today, otherwise known as PPE. We're going to be looking at 3 different masks and how to properly take these on and off, and how to properly wear these from day to day. Today we'll be looking at the standard surgical mask, the standard cloth mask, and the N95 mask. After you've removed the mask by the ear loops, you want to make sure there are no holes. Determine which side is outside and inside. The blue side is typically out, the white side goes against your mouth and nose. Then you want to determine which side is top and bottom. The top has a small aluminum strip at the top to mold against your face. You want to hold the mask by the ear loops, placing each loop around each ear. Mold or pinch the stiff edge to shape around your nose. Once it's secure, you're done. A common mistake we might see, as pictured, are individuals wearing masks incorrectly, either under their nose or loosely fitting. Remember, all facial coverings should fit snugly but comfortably against the side of the face and should be secure with either ties or ear loops. The purpose of us all wearing masks anywhere people congregate is first and foremost to protect others if we sneeze or cough. These coverings will stop much of the large droplets that could otherwise reach people as far as 18 feet away. Recently covered research indicates that surgical masks can also decrease the amount of aerosolized virus that people produce just by breathing and talking. Remember, it's important that the mask cover your entire mouth and nasal area. It is also significant to not touch the inside or outside of the mask, as you run the risk of contaminating otherwise sterile areas. The same as the surgical mask, the cloth mask is put on the same way, utilizing the ear loops and fitting comfortably over your nasal and mouth area. The N95 mask is a little more involved. Place the mask in the palm of your hand so that the straps are outside of your hand facing the floor. You set it over your nose and mouth with the nose piece fitting over the bridge of your nose. Then you want to pull the top strap over the top part of your head and the bottom strap next over the bottom. Then you adjust accordingly. Notice how I put my hair up in order to make sure that it fits comfortably and snugly. When taking off your mask, you want to wash your hands and remove the mask by the ear loops. Then you can stick it in a clean container for sanitizing and reuse later. Similarly, with the surgical mask, you do the same thing. Take it off by the ear loops, and if you want to reuse it, putting it in a clean container. The N95 is a little more involved. It requires taking the bottom strap off first, careful not to touch the front of the mask, and then the top strap off. Then you put it in your container. Wash your hands after this. Again, if you have to take your mask off, please put it in a clean container. Do not put it on a surface where you can spread bacteria to yourself and others. Thanks again for watching, and remember, your diligence, your caution, and your attention to safety is going to go a long way during this critical time. Thank you for all you do.